Hi, and good morning, everybody. Welcome to day 2 of our week-long build-up to AHP's Day on Friday the 14th of October. If you haven't watched day 1, I'm Helen Lysett. I'm the Associate Director for Allied Health Professions at West London NHS Trust, and I'm the Chair of the North West London AHP faculty. So today we are going to be focusing on our AHP support workers. Across North West London, we have an estimated 766 support workers. I actually suspect in reality the number is much higher than that, but this is the data we have available to us. And they work across all of our clinical specialties, across all age ranges, and across all of our breadth of 14 AHP professions. Support workers provide a vital function in the delivery of our services and are at the heart of our patient care. And without the essential role that they play, many of our services would grind to a halt. So it is therefore only right that we dedicate some time in this week to the vital role that they play. In North West London, we are beginning a project which is focusing on how we can really develop our AHP support workers so that we can truly maximise the brilliant contribution that they already make. And this has been led by Toria Kilsby, who will introduce herself shortly. And I'm delighted to say that we've got 3 support workers joining us today. So Kevin, AHP and Joe, who are going to talk about their experiences of being support workers and what it's like to actually support AHPs with the work that they do. I really hope you enjoy the session and that you find it inspiring. And on that note, I will hand over to Toria.
Thank you, Helen. Hello, everybody. I'm really delighted to be working with our support workers and trusts across North West London, and to introduce you to Joe and Kevin and AHP. And first of all, we'll let you each introduce yourselves and tell us a little bit about your role. So Joe, can we come to you first?
Okay, so hey Toria, and hello everyone. So I'm Joe Maslin. I'm the first radiotherapy apprentice assistant practitioner. So I work in radiotherapy, which is basically a branch of oncology which uses radiation to treat cancer. So in my role, it's relatively dynamic with who I work with. So it's quite a large MDT, so I can work with radiographers, physicists, engineers, nurses, doctors, etc. And within my role, I predominantly do machine QA checks and warm up machines to get them ready for treatment. I make sure patients are ready for treatment. And I can also assist in certain aspects of the treatment process, like making the stereotactic radiosurgery shell and things like that. So that's my role currently.
Thank you, Joe. That's great to hear about. AHP, would you like to tell us about your role, please?
Sorry, everyone. I was with my manager, Yeah, my name is AHP. My job role is assistant practitioner, profession I work with. I'm working under qualified allied professionals, AHP, supervision to support service user, the family, friend, and carers. I also play an essential role in how they experience CSCH long COVID service. Thank you.
Thank you. And Kevin, same question to you. You tell us about your role.
Hello, my name is Kevin Weavers. I'm also a physio assistant practitioner working with Brent Community Long COVID Service.
Hello.
I pretty much take control of, I pretty much work in a mixture of pulmonary rehab. So I work with patients that have got COPD as well as asthma, and we conduct a class to help them aid in their daily activities, as well as take help with referrals of long COVID patients who suffer from ongoing symptoms such as brain fog, memory loss, and fatigue. Thank you.
Thank you. It's great to hear about the variety of work in each of your roles, and then collectively the variety. I'm going to ask you next what you're most proud of in your role as an AHP support worker. And we'll go the other way around this time. So I'll come to you, Kevin, first, then AHP, and then Joe. Thank you.
My most proud moment as an AHP support worker would be when I'm working within pulmonary rehab when I'm working within the pulmonary rehab class and seeing patients develop from, it's a 6-week program, which allows it to see the patients develop from week 1 all the way to week 6. My proudest moment is when patients tell me that they feel like they can't complete exercises or struggle with the aerobic components of the task. And at the end, they see the massive progress that they've made, and they've put entirely onto me for being a good motivator and also encouraging them when they've had a very low self-esteem.
Thank you. Yeah, really key skills there. No wonder that's so rewarding. Thank you for sharing that. AHP, same question to you. What are you most proud of in your role?
I'm seeing our patient making progress in their recovery via living with long COVID harm. You know, it gladdens my heart when I see most of our patients, you know, making progress, you know, doing well. Yeah, I feel cool. Yeah.
Thank you. And Joe?
So there's 2 things I've found I'm probably most proud of from my role currently. So one was developing a pilot infection control project, which helps reduce virus and bacteria levels passively. And I think it's important because I think innovation's very special in healthcare, and it's the only reason things can get better. And the technology which we've implemented hasn't been used before in Imperial. So that's the first thing. And I've got to work a lot with the head of radiotherapy. So that's been quite good, really, because usually in a healthcare support role, you don't necessarily have that close of a relationship with the head of the department, but I've been quite lucky in that sense. And the second thing is I've helped develop a QI project with a consultant doctor, which is basically looking into how to improve the quality of life for radiotherapy brain tumor patients who might be anxious about starting treatment. And it's something that we haven't had much data on before, and it helped me work with lots of different multidisciplinary team workers, including the consultant himself. So I'm happy to have contributed in some way to this data. So that's probably my ones.
Thank you. That's fantastic to hear from all 3 of you, just how important your roles are in terms of the impact that you're having directly with the patients that you're working with and their families, but also your opportunity to be involved in quality improvement and in innovative practice development and service development. So really great to hear about those. Thank you. And finally, I'm going to ask you to tell us something about your work that might surprise people. What might we not expect that you do in a typical day as an AHP support worker? And this time I'll come to AHP first, and then Joe, and then Kevin. Thank you.
Thank you. I saw a patient with post-COVID syndrome and various emotional conditions, e.g. depression, anxiety, brain fog, and behavioral mental health condition. We are living with HAP, like I said earlier on. So we do clinical telephone call, also trihygiene or boarding patients so living with HAP, and assisting with troubleshooting. Also, I use my IT skill to assist most of our patients, you know, who are struggling with living with HAP application on their mobile devices. Yeah.
Brilliant, drawing on a really broad skill set there. Thank you.
You're welcome.
And Joe, same question to you. What might surprise us about your role?
So I think what would surprise most people about my role is that I do have a leadership position where that I'm the leader of a healthcare support worker group, which is across Imperial College. And I think most people wouldn't presume if you're a healthcare support worker, you're able to do so. And it's something I think we're going to be able to make a big difference with. So yeah, just that generally. So I think most people just think, oh, you can't be in any kind of leadership if you're working as an apprentice or healthcare support worker. So that's my one.
Absolutely, and we're really keen to grow more of those opportunities for support workers, so great to hear about that. Thank you. And finally, Kevin.
I would say for me, like when I attend like pulmonary rehab classes, I feel more like a PT. So I'm like, when the patients are conducting exercise, I'm very strict on them that they conduct it in the perfect manner and with the perfect technique to like eradicate any injuries from happening. So I'm very proactive in that. Another one I would say is I'm also a good motivational speaker, I've been told, by patients as well. So yeah, I'm really working with long COVID patients, really speaking to them and hearing their part of how they living with it and the effects it's having on them mentally and psychologically. So yeah.
Thank you all three of you. It's been really great to just have a little bit of an insight into your roles, the breadth of skills that you bring to your work, and all of the opportunities in your roles as well. And thank you all for tuning in, and I hope you come back and hear our AHP Day video tomorrow, and happy AHP Day to everyone for Friday. Thank you.